Hello, listeners. Welcome to Views on Health. Back with us on the program this week is Dr. Neomal De consultant endocrinologist, District General Hospital in Matale. Welcome back to SLBC, Doctor, and a pleasure to have you with us on the program.
Hello, it's a pleasure to be here and thank you very much for having me back.
So, having discussed hypothyroidism last week, and as we did inform you, tonight Dr. Neomal De is going to speak on hyperthyroidism. Hyper, overactivity. Over to you, Doctor, to introduce hyperthyroidism.
Yes, so I think last week we discussed a little bit about the thyroid gland and where it is and what it does and all that. So just to recap, thyroid is this butterfly-shaped small gland at the front of your neck, and it controls a lot of your bodily functions, including the rate of your all metabolic functions, your heart rate, and everything. So last week we discussed the deficiency of thyroxine. Now today it's about the excess. So as with all other hormone organs, either the deficiency or the excess, both can cause problems. The thyroxine hormone excess also can lead to many symptoms and signs, and also it could even lead to very serious problems, including problems with the heart. So that is why, again, it's very important to identify it and also give the appropriate treatment. And there are different treatment modalities available. And it is, I would say, again, reasonably easily it can be treated, and also it can be detected quite easily as well with a blood test. So that is why I think, all our listeners, I think it will be very helpful to know about the symptoms of thyroid overactivity, to identify it early and to get the appropriate treatment.
So, Doctor, what are the signs and symptoms of hyperthyroidism?
Yes, so these symptoms actually would be kind of the opposite of the symptoms of hypothyroidism or the low thyroxine. So again, there are many symptoms. So one thing is they can be sweating excessively. So excessive sweating is one thing. And also what we call the heat intolerance, so they will be feeling warmer compared to the others, so that is another thing. And also when the thyroid hormone excess is there, it will affect your sympathetic nervous system. So because of that, your heart rate will go up. So because of that, they can get palpitations. And also they can fear, even it can affect their psychology, like it can affect their mental status as well, so they can be quite anxious. And also they can get tremors, so they can be very fidgety, and they can get tremors, so that is another thing. And also some people can have diarrhea as a symptom of that, and also again periods can be irregular. And also another thing is, so usually those with thyroxine hormone excess, they will be hungry all the time, they'll be hungry and they'll be eating a lot. But still, despite eating a lot, they will be losing weight. So that is another, important hallmark of this disease. So they will be eating a lot, but still they will be losing weight. And also some of I think we will go into detail about the different causes for thyroid excess, but some of these causes can cause problems with your eyes as well. So sometimes you can have either redness or swelling or bulging of eyes. So again, sometimes some problems with the eyes also could be a sign of thyroid problems. I think these are the sort of most important main symptoms, I think, that we need to be vigilant on.
So if a patient comes to you with some of these symptoms, if not all, would you still run a test? Last time you said there'll be a simple blood test to detect hypothyroidism. For hyperthyroidism, what would you do?
Yes, so exactly. I think, when someone comes with these symptoms, obviously, we will go into detail and we'll do the examination, we'll palpate the thyroid gland, which is in your neck, and all that. But yes, for definitive diagnosis, as you said, we need to do the blood test. And it is the same blood test that we did for hypothyroidism. So it is called TSH. You might remember from last week that we discussed TSH is actually coming from the pituitary, and when the thyroxine hormone level is low, TSH will be high. The same way, when the thyroxine hormones are high, TSH will be low. So when we do this TSH test, again, it does not need fasting or anything. You can just do just a simple blood test. The TSH level will be very low, and in most instances, if it is the thyroxine excess is severe, it will be undetectable. And also usually we do the free thyroxine hormone level as well, what we call the free T3 and free T4, and they will be high. And how high they are will guide us about the doses of the drugs we give and about the treatment and all. But yeah, again, it's a simple blood test, TSH, free T3, free T4, which can give us the diagnosis.
So once diagnosed, how would you treat this condition? Because, for example, you spoke of a person eating, still losing weight, not being able to tolerate heat, and there are things like it affects one's mental status. In what capacity does it affect the mental status? Could you explain all that, doctor?
Yes, definitely. So I think mental status wise, most people with thyroxine hormone excess, they feel quite anxious. So they will be very anxious, fidgety, and also sometimes they may get, excessively angry as well. So they can be very irritable all the time. So all this sometimes, it could be due to some other reason as well, but it could be a sign of thyroxine hormone excess as well. So this excessive irritability, anger management issues, anxiety, all these could be due to thyroxine hormone excess. So that is why it's very important that we treat it immediately and to get the thyroxine hormone levels under control. So if we discuss about treatment modalities, broadly actually there are 3 treatment modalities, but in almost all the cases usually we start with the tablets. So I think I will go into that first. If we discuss about the tablets, again there are broadly commonly there are 2 types of tablets we use. So one is what we call the beta blockers. So this we give, I think I mentioned before, when the thyroxine hormone is excessive, it will activate the sympathetic nervous system. So in those with thyroxine hormone excess, there is overactivity of the sympathetic nervous system. So most of the symptoms, like things like palpitations, the sweating, these things are due to that sympathetic system overactivity. So to control that, we will give what we call beta blockers. So we will give that for the immediate symptomatic benefit. But of course, in the long term, what we need is to bring the thyroxine hormone level to normal. So to do that, we use tablets. These tablets will reduce the thyroxine hormone production from the thyroid gland and will help to bring it down to normal levels. So that is usually in most cases our first line treatment, but there are other treatment modalities which we will go into detail later.
So is this tablet to be taken first thing in the morning, like for hypothyroidism, or at which time of the day?
Yes, so again, so this is a bit different to thyroxine. So there are 2 types of tablets which are commonly used. So one is called PTU or propyl thiouracil, but usually we don't use it as the first line treatment. There are certain specific instances where we might use it, but in most people that is not the first line. So for most people, the first line treatment what we use is a tablet called carbimazole, and that of course can be given either once, twice, or even 3 times a day. So and also, unlike thyroxine, it does not have to be as the first thing in the morning. So those things do not apply to this tablet. So I think that is an important distinction that we need to make. So the tablet is carbimazole, and the dose and everything will be determined by how bad the thyroxine excess is. And also it can be, depending on your condition, the doctor will prescribe it either once, twice, or even 3 times a day. The important thing is to take it regularly and diligently. to bring the thyroxine hormone level down to normal as soon as possible.
For how long would you prescribe this medication? Of course, it will vary from patient to patient and depending what other conditions they have, but generally to neutralize or bring it down to the accepted level, for how long should a patient take these tablets? You said once or twice, even 3 times a day.
Yes. So
But for how long?
Yes, I think that's a very important question because last week we discussed thyroxine. Once you start it, most likely you will be taking it lifelong. But this is a bit different to that. So I think that's why we need to get some other background knowledge as well, because how long you take, it depends on the exact etiology of your thyroid excess as well, the exact reason, because there may be different reasons that cause thyroxine excess. So that is why, so that will determine. So I think probably we can discuss a little bit about these different sort of causes for thyroxine excess, and then I think we can come to the duration.
Continue, doctor.
Yes. So there are different reasons why your thyroxine gland may be producing excess hormones. So one reason is what we call Graves' disease. It is an autoimmune condition, like what we discussed last week, where your body's own antibodies will act on your thyroid gland. But I think last week we discussed in the case of hypothyroidism, these antibodies will destroy your thyroid gland and the thyroxine hormone level will go down. But also there are different antibodies which will cause the thyroxine gland to produce excess thyroid hormone. So that is called the Graves' disease. So that is one of the commonest causes. So in that case, what we usually do is we give these tablets for a duration of about 1 year to about 1.5 years, and then we reassess the thing. So sometimes we are able to stop the tablets and they will be okay without anything. So but that is only about 50% of the people. But for the other 50%, usually we might need some form of definitive treatment. I think we can discuss about that later. So that is about Graves' disease. And then also we get something called thyroiditis, which is essentially an inflammation of the thyroid gland. And actually this is, unlike the Graves' disease, this is quite short lasting, and actually in most of the time for this thyroiditis, or like swelling of the thyroid gland, it temporarily will increase your thyroxine hormone levels, but usually this is not a long lasting condition, and this usually this should settle within like 2 to 3 months. In this condition, actually, sometimes we don't even give this tablet I discussed. So usually we can manage only with beta blockers, and then in about 2 to 3 months you should be okay. So that is another thing. And also sometimes in the thyroid gland you can get these nodules, so you get what is called toxic multinodular goiter, and also maybe that means there are a lot of small nodules which are secreting excessive thyroxine hormone, or a single nodule which is secreting the excess thyroid hormone. In these cases, usually if you are taking the tablets, you will have to continue it long term, and usually we might not be able to stop it. So usually, since we do not like to give this tablet like for years and years, usually after initially controlling the thyroid hormone level, then we consider going for a sort of a definitive, like more sort of permanent solution.
Now, will this condition affect a pregnant woman? Last time too we discussed that it can affect the fetus if there is a lower level of thyroxine in the mother, and that has to be addressed. Now in this situation, when it's more, it's hyper, how does it affect the fetus?
Yes, I think that's a very important question, because this thyroid hormone excess is also a very important condition in pregnancy. So again, then what we need to know is everything that we discussed before can happen in pregnancy as well. But also we need to remember sometimes, especially in the first trimester, or like say the first 12 weeks of pregnancy, I think we discuss the test we do is TSH. So TSH in the first part of pregnancy, especially like first 12 weeks, when you do a TSH, it may be a bit low. So that is actually not really a disease. This is what we call the transient gestational thyrotoxicosis. So like a little bit of thyroid excess that you get in the initial part of pregnancy. This is because sometimes you may have heard in pregnancy there is a hormone called HCG. That hormone level goes up in the pregnancy. So this hormone called HCG is quite similar to the TSH. So because of that, it will can cause a little bit of increased thyroxine hormone level, but usually for that you don't always have to take tablets because that's mostly a natural phenomenon. And also there are some pregnant women who get what we call hyperemesis gravidarum. So this is basically excessive vomiting in pregnancy. So those pregnant women also can have a little bit of a low TSH. But usually, this should come back to its normal on its own. So usually we might not even have to give any tablets specifically for that. But again, as you said, sometimes women can get Graves' disease. So I think that's again important to know, because the tablet that we discussed before, carbimazole, usually we don't give it in first trimester of pregnancy because we are concerned a little bit about the effect of that to the baby. So usually in the first trimester we tend to give the other tablet we discussed, which is called propylthiouracil, and that is because it does not have much effect to the baby. And then we switch back to the carbimazole after the first trimester, because then the baby's most important organs have already formed. But yeah, so this can happen in pregnancy, and if that happens, we very carefully need to give the tablets and carefully bring the thyroxine to normal levels. That is very important, because otherwise it can have effects on the baby, pregnancy, and the mother.
Similar to hypothyroidism and in pregnancy, or you did say that a woman who wants to have a baby and she wants to get pregnant should take certain precautions. It should be the same where this is concerned. Now, she knows she is hyper, and therefore before she becomes pregnant, it will be sensible to bring the level to normal. Would you comment on that, please,
yes,
doctor?
Exactly. I think that is very important, because if someone is having this hyperthyroidism, especially a lady of the childbearing age, so if they are planning a pregnancy, I think I would say the ideal thing is they go for the definitive treatment. So I will go into that as well now. So basically there are two treatment modalities which can give sort of permanent solution. So one is surgery, so what we call the total thyroidectomy, or you remove the thyroid gland by a surgery. Again, it's done under general anesthesia. So and there could be surgical complications and things like that. So that is one option. And then the other thing is what we call the radioactive iodine. So this is basically a small pill which is radioactive, which you take, and then radiation will kind of burn out your thyroid gland. So these are the two options. So if you are planning a pregnancy, I think ideal is you go for either of these and get a permanent cure to your thyroid overactivity. But of course, if you went for the thyroidectomy, then you will be taking thyroxine lifelong, because obviously you no longer have a thyroid gland. But the other thing is, if you go for this radioactive iodine, you have to wait for 6 more months after that, because it is radiation treatment, so it will be harmful to the baby if you get pregnant. So you have to wait for 6 months if you go for that. So that would be the ideal. But if not, then the option is you continue the tablets. But again, as I discussed, if you're on carbimazole, then when you are planning pregnancy, usually we will change you to the other tablet, because that other tablet is safer for the baby, especially in the first 12 weeks. So we will change you to what we call this PTU, or propylthiouracil, because for the first 12 weeks of pregnancy, that is safer for the baby.
In certain situations, assuming that the husband is also hyper, how does that work?
Yes, so usually it will not have a major impact, but I mean, obviously, even if a man has the thyroid overactivity, then yes, it's always better to get the treatment and get it under control. So as we discussed, the three options, he can take it, do it with tablets, so the surgery or the radioactive iodine. So if it is the surgery or the tablets, then it will have no bearing on the pregnancy or the baby. But again, if he goes for the radiation, then again, even a man, I think it's better to wait at least 3 months or 4 months before, because some radiation residue could even be there, and which could affect the pregnancy. So that's the only thing, but otherwise it will not have a major impact. But if you go for the radioactive iodine, even for a man, I think it's important to wait a little bit before you father a child.
You said, doctor, that the treatment can go for 1 or 1.5 years, and then you assess the patient. Now, basically, generally, or would you say that most patients within that time frame come back to a normal level?
Yes. Yes, so usually what happens is we start you on the tablet initially, and then obviously we monitor the thyroid hormone levels. So initially maybe even every month or so, and then we adjust the dose of the medication, and we get the thyroid hormone under control. So yes, I would say almost 90 or 95%. Yes, we with this tablet we can bring it down. But yes, as you said, there may be about 5% who, even with the maximum dose of the tablet, the thyroxine level may not come down. Then sometimes we use some other types of treatment or tablets which are not usually used, but in these rare instances we might have to use, and then try to bring it under control. But in such situations, it's always better to get it under control and then go for the permanent solution, because especially high doses of these drugs, we do not advise taking these high doses in the long term. So usually we try to get it under control and then go for the surgery or the radioactive iodine treatment. So we monitor them, and then after about 1.5 years we try to see whether we can stop the treatment. So in some people we are able to stop it, and then they are okay without the pills. But some people, if we stop it, this is about 50-50. So 50%, if we stop it, it will come back. So in that case, we will restart the tablets, but then seriously consider one of the permanent solutions.
If a patient is diabetic and still is hyper, how does that work?
Yes, so I think diabetes is so common nowadays in Sri Lanka, especially even in Colombo district, is very common. So a significant portion of people will have both these conditions. Then obviously it's important to get both under control. So, and also the medications won't sort of interact in a major way, so it should be very safe for you to take both. But you need to remember, even diabetes itself will increase your risk of heart attacks and things. And also this thyrotoxicosis, if it is not controlled, like thyroid hormone excess, it will increase your heart rate, and it can cause changes to your heart rhythm, and can even make you more prone to heart attacks and things like that. So it is very important, especially if you have other things like cholesterol, high blood pressure, diabetes. It's very important that you get this under control, otherwise you are at very high risk of heart problems. And also this excessive thyroxine hormone will weaken your bones, so it's from that aspect as well, it's very important to get it under control.
Any other complications that can arise because of a person being hyper?
Yes, so I think that's again very important, because I think we discussed about this autoimmune condition called Graves' disease. So Graves' disease, other than the thyroid gland, it can also affect your eyes. As we discussed before, some people can get redness, swelling, pain of the eyes. So if that happens, then what we call the thyroid or dysthyroid orbitopathy, or the Graves orbitopathy. So basically that is this Graves, this is affecting your eyes. So if that happens, obviously still you need to get your thyroxine level under control, but other than that, you may need some special treatments as well. So usually we endocrinologists, we usually combine with the specialist doctors in that, sometimes eye surgeons or specifically oculoplastic surgeons who deal with these problems. We talk to them and we get together and manage this eye problem. So yes, so that is another complication that you get due to Graves' disease. But also, as I said, it can affect your heart, your bones also can get weaker. So those complications will also be there.
Just one more question before we wind up this interesting discussion. You said that young people are also prone to this condition. And if so, the younger they get it, would there be more issues to deal with as they advance in age?
Yes. Yes, so I would say when you have thyroxine excess, only thing is if you get at a younger age, sometimes you may be able to tolerate it better. Because this thyroxine excess could be actually deadly in older people, because when they're older, their hearts are anyway a little bit weaker, so they are not able to tolerate this because their hearts are not stronger, their body anyway is weaker, so they don't tolerate it as well as younger people. But even for younger people, if you keep it untreated and if it goes on for a long time, and even young people, I have seen young people, their hearts becoming completely weak, what we call heart failure. So this untreated thyroxine excess, if it goes on for a long time, even for young people, it will be a major problem. It will affect all aspects of their life, including the heart, and even going for pregnancy, all these things will be affected. So whatever the age, it is very important that we identify it early and treat it immediately.
Your take-home message?
Yes, so I think even for this condition, the take-home message is, as we discussed, the symptoms which are like excessive sweatiness, or feeling warm all the time, or feeling very anxious, irritable, angry, or palpitations, or tremors in your hands, or your eyes suddenly becoming red or swollen or painful, anything like that, any combination of these things, I think better to think whether am I having thyroid hormone excess. So if you have any doubt, again, please go to your doctor as soon as possible and get this simple blood test. And then they will be, maybe a family doctor can direct you to the relevant specialist and then get it treated. Because as soon as you get the thyroxine hormone level under control, it will be better for your long-term health. Because this is a very serious condition which, if untreated, could even end up in death. So that's why we need to identify it, and early recognition and proper treatment is the key.
Thank you, Doctor. On that note of advice, we end yet another interesting discussion, and this time on hyperthyroidism. To you, Dr. Neomal De Silva, consultant endocrinologist at the District General Hospital in Matale, we say a sincere thank you for being with us once again on the program and sharing your valuable insight into this very important health aspect. Thank you, Doctor.
Thank you very much. Thank you very much for having me here, and it was a pleasure to be here and to share this knowledge.
Our pleasure always, Doctor. Thank you to Prabha Veerasuriya for technical assistance. I'm Fatima Razi Kader saying good night and looking forward to your company next Monday, same time on Views on Health.